Are we ready? Well, good morning. I'm here with our health director, Denise Fair, our medical director, Rob Dunn. We got good news out of the CDC and the FDA on Friday, and that the third shots have now been approved for everybody 18 and up who's been vaccinated more than 6 months. And we are rolling out those boosters to every Detroiter at every site. And let me take you through what's happening, something we've talked about over and over. I showed you this chart. I stood here last August and said, this is the hotspot chart in America. And in August, people up north are outside and people down south are indoors. And we know COVID circulates far faster with indoor ventilation than it does outdoor. And as I stood here in August, it said, in November, this is going to flip. Because every November, I know when I ran the hospital system, the flu season kicked in. 2 weeks ago, the national map looked like this. Down in the south, where they are outside, it has now dropped. And up in the north, it's increased. But I want you to look at what's happened in just the last 2 weeks. That was 2 weeks ago, Michigan. Look how much redder it is 2 weeks later. The state of Michigan is now the center of the spread of COVID-19. It's not a surprise. This is our prime flu season. Everybody in the medical field predicted that this was what was going to happen in November, December, and January. And so if you look at the state of Michigan, and these are the cases, you look at what you have here. Statewide, this is the highest rate of infection we have had. That's where we are today. And in the city of Detroit, not quite to our peak, but I would suspect in a week or two, Detroit will exceed that as well. Here's the thing that is most deeply troubling. These are Detroiters in hospital beds today. And just in the last 2 or 3 weeks, we have doubled the number of Detroiters in hospital beds to 256. That's a doubling in basically 3 weeks. If it doubles again in the next 3 weeks, we're going to see the most serious problem we had since the spring of 2020. And so this is something that we have got to address today. So what do we have? The FDA on Friday stepped in and authorized booster shots for everybody 18 and over who's time eligible to do it. It's something that we've been pushing for a long time. And for those of you who want to protect yourselves, we've got way too many people aren't vaccinated. But for those of you who did the right thing, got vaccinated last spring, and want to stay protected, you have an absolute right, no problem, to go in and get that third shot. I've had my third shot. Everybody up here's had their third shot. The senior management in the mayor's office had their third shot. And you can go to any of our vaccine locations, get that third shot, if it's been 6 months or more since your second Pfizer or Moderna shot. So basically, you got your second shot in May or earlier, you can get that third shot now. Or if it's been 2 months or more since you got your Johnson & Johnson shot, they figured out that Johnson & Johnson needs a second shot. So in either of those cases, you can get your booster shot. If you're not sure, call your doctor, because at this point, this is very well understood. I want to show you a chart, which I hope you can see here, because it shows you why the third shot is important. There's 2 lines on this chart that came from a CDC study. The first line is if you had your first 2 shots, over time, what happens to your protection? The red line is your protection against hospitalization. And this is what we found, that you get the Moderna and Pfizer shots even after 6 or 8 months. You're probably protected against the most severe disease. You're probably protected against being hospitalized. There's enough antibodies in your system that they will react in time for most people that you're not hospitalized. So this is pretty reassuring. But it doesn't mean you won't get COVID. And this is your protection level over time about getting COVID in the first place. And as you can see, your protection starts to drop. This is the reason for the third shot. So if you don't go get the third shot, you're probably not going to get it badly enough to be hospitalized, although you can certainly get it and spread it to people around you who are unvaccinated. And then when you look at the hard numbers, nobody knew last spring when we started doing the shots how long they were going to last. But now we know a lot more, and the Delta variant has changed everything. If the Delta variant not come along, COVID would be in our rearview mirror. But it has been so much stronger than anything that we had seen. So here's what we know. When you first get your vaccine, you got a 96% protection rate against getting COVID. After 6 months, it drops to an 84% protection rate. After 8 months, it drops to a 75% protection rate, which means that after 8 months, you got a 1 in 4 chance of getting it, even though you had the vaccine. And so what we're saying is, don't take that 1 in 4 chance. Go to the TCF Center, go to CVS or the pharmacies, go to any one of the city outreach centers, get your third shot, get back up to that 96% protection level. You already know what this is about. So what I'm really pleased about is the people who did the right thing, who went and got vaccinated in the first place. You can now be fully protected with that third shot. And if you hadn't had your first shot, I know we've said this for a long time, but here's what happens. You are 11 times more likely to die from COVID if you haven't been vaccinated. We have far too many people in this country that we have lost because they believed some nonsense on the internet and decided not to get the vaccine. There's no place in America that it is easier to get a vaccine in the city of Detroit. You can do it at any one of our sites. We come out to the nursing homes, we come out to the homeless shelters, we'll come out to your house if you're homebound. Whatever you need, the city of Detroit is there to make sure that you can get vaccinated. But if you look at the trend of what's happening, if you haven't done it by now, you should go ahead. So as of today, the third shot boosters are available at all city-run vaccine locations 6 days a week. You can either do it by appointment with the 313-230-0505, or you can just walk in. We've made it as easy as possible. We've got 10 walk-in centers, 6-day-a-week options for that third shot. And so we're asking folks to take advantage of what the FDA has allowed us to do and move forward. And with that, I will turn it over to our Health Director, Denise Fair, to talk about what you should be doing.
Thank you, Mr. Mayor. So as the mayor mentioned, all of our numbers are going in the wrong direction. Our cases are increasing. The number of people that are in the hospital due to COVID is also increasing at an alarming rate, as well as our percent positivity. And so the onus is upon us. The ball is in our court, to make sure that we stay protected. And here's how you can stay protected. We want you to get vaccinated and get boosted when you are eligible. And right now in the city of Detroit, everyone ages 5 through 11, let me say this again. Everyone in the city of Detroit, ages 5 and above, are now eligible to get their vaccine. Also, get tested regularly, whether or not you are vaccinated. In fact, this morning I had the opportunity to go to the Joseph Walker Williams Center to get my test, and I am negative. Also, if you test positive, contact your doctor immediately. There are COVID-19 treatments that are available today that were not available earlier in the pandemic, and Dr. Dunn will address those momentarily. There are free COVID-19 tests available without a prescription, and as I mentioned, you can go to the Joseph Walker Williams Recreation Center at Rosa Parks Boulevard to get tested. You don't need an appointment, you can just walk in. You can also make an appointment if you'd like by calling 313-230-0505. Now, I know people want to celebrate this holiday. We want to enjoy with our family and friends this year, and we can do that. But this is not the time to let your guard down. We do need each of you to take simple precautions in order to stay safe this holiday. And so I will share with you a few of these. If you are going to celebrate this year, again, the best thing that you can do is to get vaccinated, but also keep your gatherings small and with your immediate family. I know this holiday season, I do plan to celebrate with my immediate family. It's going to be really small, and all of us will get tested. If possible, celebrate outdoors. I know we're in Michigan, so it's a little cold outside, but if you do celebrate, try to celebrate outside or in well-ventilated areas. Wear your mask when you are indoors, especially in public settings, because you don't know if the person next to you is vaccinated or not. If you are traveling, these rules also apply to you. Avoid crowded areas, keep at least 6 feet distance, wash your hands, practice social distancing, and stay safe. But the bottom line is, no matter what your holiday plans are, please get tested at the max 72 hours prior to gathering with others. Again, it's better to know before you go. And finally, if you are not feeling well, if you have a head cold, runny nose, please just stay home and ask for your grandmother to save you a plate. And finally, by working together, we can protect each other. We can protect our family as well as our friends. So for those of you who didn't hear the first time, please schedule an appointment or walk into any one of our sites. You can give us a call, 313-230-0505. And with that, I'll turn it over to Dr. Dunn, our acting medical director, who's going to share with you some messages about our treatment options.
Thank you. Just to emphasize what Director Fair is saying, getting vaccinated is still our #1 way of preventing you and your family and others, particularly those who can't be vaccinated for one reason or another, from getting disease. I want to just talk a little bit about the number of cases that we've been seeing at physicians, emergency departments, and hospitals. We have learned a lot about treating COVID over the time of the pandemic. There are multiple treatment options available to people, including treatment options that can help prevent people from being admitted to the hospital and ultimately dying of COVID, particularly the monoclonal antibody treatment, which is available around Metro Detroit. So if you're sick, get tested. If you have COVID, talk to your physician. The other thing that we've really learned is that remote health and telehealth is a great way to keep an eye on people and to do assessments, and can lead to the referrals to get that needed treatment. So I just want to make sure that message is out there. We have treatments available. We understand a lot more about the disease, and all of our hospitals are ready to treat COVID patients, but we want to try and keep people from having to be admitted. Thank you.
All right, with that, we'll take any questions.
Good morning, Mayor. Thank you. 2 questions for you, one on COVID, one unrelated. The first being, could you please update the status of a vaccine mandate for city employees, if that's something that's still being considered and could be implemented soon? And a second question pertaining to security for the upcoming Thanksgiving parade and your thoughts on that. Thank you.
So let me start with this. There is absolutely no conversation about vaccines for union or civil service employees. I got a call this morning from one of the public safety union presidents who asked me about this, and I didn't know when he called what he was talking about. I made an absolute promise to the union leaders in this city for the last year and a half that anything that we did, we would do together, sitting down and talking. And there's been no conversation about that at all, no plan for it. The one thing that I am interested in, and we got a little bit of ahead of ourselves on the advisory today, is we still have in the city of Detroit a very low vaccination rate. And one of the things that I want to do in the next week or two, if this continues to go the wrong direction, is I think the mayor's office ought to establish a leadership role. That we're talking about the appointees in my office, which is a pretty large executive office, all being vaccinated. Now today, it isn't going to take that much. Deputy Mayor Mallett's had his 3rd shot. Chief Operating Officer Akeem Berry's had his 3rd shot. Chief of Staff Tricia Stein's had her 3rd shot. And we're really talking about, shouldn't the mayor's office provide leadership And do we do something on a vaccine mandate front for our appointees? And then the second question is, could we show leadership in creating a COVID-free zone? If you go into our office today, it is a beehive of activity with people jammed in small conference rooms. And I have some responsibility, a serious responsibility to protect our employees. But you look at what's going on now, we're about to roll out the largest home repair program ever done in the state with 1,000 roof repairs. We're very close to a plan to improve the basements of people in low-lying areas, prevent flooding next year. We've got major training and education programs, major development programs, and we've got lots of people packed into small places working on this. We can't afford to work remotely in the city of Detroit. We need to be at work. And so we're talking about, could we create a COVID-safe zone within the mayor's executive offices where everybody who comes into the office documents they're vaccinated, and if you're not, there's some kind of video conference option that maybe you participate without being there. And so we are exploring the mayor's office being a leader. And that was the reference that was made. We went from yesterday saying this is something that we ought to develop to putting in an announcement today. But I think in the next week or two, we will do something where the mayor's office will show leadership.
Just one other question off subject, but, and separately, many are thinking about the upcoming Thanksgiving parade and security, obviously with the events of the last week. Would you share a thought on that?
So I'd encourage you to talk to Chief White. He has been in contact with the police leadership in Wisconsin from the day of that tragedy, and at least all indications are now it was an incident of an individual who was fleeing from a situation and not any part of any planned attack, but it has caused DPD to take a very close look at security on all aspects, and I know Chief White is deeply engaged in that. I think he's in a meeting on it right now, and I'd ask you to talk to him about the details on that, but it's very much top of mind. And I will be in the parade tomorrow, driving Grand Marshal Edgar Van and giving the key to Santa Claus, so I'll be out there with everybody else on Thursday.
Mayor, just to follow up real quick, the 3 casinos, I understand now, are having a mask mandate.
Okay.
Is there any thought about masks and how important is it to wear a mask, and particularly because of the Thanksgiving parade, which would generate a lot of people?
Yeah, we've said this a lot of times, and I think what individual private companies are doing is good. And I'm hoping to create an example in a COVID-safe zone in the mayor's office that other private companies will adopt as well. So I think it's a great thing. I think the overall mandate has to be at the state level. You just can't have one standard in Hamtramck and one in Detroit and one in Ferndale. But I think what the private companies are doing makes great sense, and if I were running a casino, I would do the same thing.
And Mayor, just continuing on that thought of the state leadership kind of on this, or a state vaccine mandate, I mean, would you like to see that kind of move happen on a state level?
The governor's got really good advisors, and she's doing that analysis, and I will support whatever decision she makes.
Understood. And for the health officials, I think just going over some of those guidance that you talked about, getting tested regularly, how regularly are we talking about?
So I think that the testing really is aimed at what you're doing and who you're interacting with. If you're in a situation where you're interacting with a lot of people and you don't know people's vaccination status, getting tested weekly or every other week makes a lot of sense. If you are planning to go to an event or you're traveling or you've just returned from traveling, getting tested, because we know from the entire pandemic that 25 to 30% of people who are infected have no symptoms. So testing is still an important strategy.
Sure. And in regards to the actual, holiday gatherings, are you advising people not to hold like a Thanksgiving dinner? Let's say if you have your aunts and uncles, multiple households coming in for dinner.
So if I think it really depends on the social circle. If these are people that are already in your social circle that you're normally interacting with and you've taken appropriate precautions, I think that's fine. I think multiple people coming in from out of town creates a situation that it's much more likely for people to get infected.
Great, thank you.
Just one follow-up. Are the clinics open Thursday, Friday? Could you just address what clinics are open for testing and vaccines?
Yeah, so they're closed on Thanksgiving, and they're closed the day after, so the 25th and the 26th, all of our sites will be closed.
All right, thank you very much.